Greetings, clinic members and prospective clinic members. I'm speaking to you today, fireside on a snowy January day. It's lovely to be here and speaking with you. I hope that others of you are in a similarly cozy situation on this day. I would like to speak to you today about the growth of the clinic and what that means for existing members and prospective members. I'm mostly going to be addressing this to the folks who've been patiently waiting on our waiting list, but some of our existing members, I'd also, first of all, like to say thank you for your fidelity to the clinic over the years and for making possible the work that we do and for making it difficult for us to grow by sticking with us. So thank you for that. And in the interest of protecting your time, those of you who would like to hear a quick message, I'm going to give my message very quickly. If, like me, you're sitting by a fire and would just like to settle in and hear a little bit more about our clinic and the way we think about our work, you're welcome to settle in for the long talk. But here's the short talk. We have a wonderful new physician, Dr. Brewer Eberly, coming to join us in August of this year. We have been wooing him and talking to him about this work for about 4 years now, so this is a long awaited moment for us. He will finish his training in July and start with us in August. In the interim, we have an outstanding, recently retired physician, Dr. Robert Adams, who has agreed to help be the interim physician, and he will take on any patients who would like to be attended to starting now, and will continue to care for them until August, when he will hand off to Dr. Eberly. That combination of doctors and the setting in which we can offer them to you is what I would choose for anybody that I care about. So these are the doctors I would want my own family to see, and I think it's the right choice for any of you who have been waiting to join Fischer Clinic to sign on with these doctors. So that's the short message, and the longer message starts now. So if that's all you need to hear, sign up with these wonderful doctors, and we look forward to caring for you. For those of you who'd like to hear a little bit more about how we know Dr. Eberly, who Dr. Eberly is, and how we work, here's that second part of the message. So the way we work is based on a firm commitment that Dr. Lipinski and I share to the sanctity of the doctor-patient relationship. We believe that we should stand by our patients in whatever they face, in sickness and in health, and help them through whatever adversity in health that we can. And the nature of the commitment of that relationship is such that we can do that well for a certain number of people, and then we cease to do it well. And figuring out what our capacity is, how many people we can care for, is somewhat of a work in progress. As you might imagine, that would depend both on our own speed and ability to think quickly. It would depend on the nature of the patients that we see, how sick they are, and what their characteristics are. And so it's hard to be precise and say, oh, this is the number of people we can care for. So we have grown to the point where we realized, I think we need to stop, and then we have stayed at that point for several years now, and we have been receiving requests during that time from our existing patients to take on their family members, and from people we don't know before who know enough about us that they would like for us to care for them. We're honored by those requests, and of course we want to meet them. We want to answer those, but we recognize that we can't do that and continue to care well for our existing members. And so the nature of growth in a practice like ours is that growth does not happen by Dr. Lipinski and I each taking on more people and stretching ourselves thinner. It happens by us inviting in other worthy doctors and nurses to join our community and extend our reach and ability to serve other people. And I'd like to communicate a message to our patients who've been waiting for us personally, both myself and Dr. Lipinski, a message of genuine humility, that it is not about me, it's not about Dr. Lipinski, it's about our shared commitment to our patients and our relationships with our patients. And worthy and good physicians and nurses put into that kind of setting with those convictions will do good work and will care for you well. And Dr. Eberly, Dr. Brewer Eberly, is just such a physician who is eminently worthy, and I might tear up a little bit as I do when I talk about my current partner, Dr. Lipinski, because the depth of my feeling about them is such that these are people who I want in my life, and I want to be in your life. You may know that I met Dr. Lipinski through one of my closest friends, Dr. Carrie Witt, to whom I asked when I had initially reached what I thought was capacity, who would you recommend to me? Who should I talk to as somebody else to bring into the clinic to help take on some of these patients who would like to be seen? And he said, you need to call Zane Lipinski. And it was just, that's who you need to call. And he knew him by his work, by the patients that they had shared, since Dr. Witt is a gastroenterologist, as many of you probably know, because many of you have seen him. So based on Dr. Witt's recommendation, I proceeded to get to know, I sought out Dr. Lipinski, and the joke that many of you may have heard, I had to pursue him longer than I pursued my wife. He was not somebody who just needed a job. He was beloved by his patients, as he is now, and had a setting in which he was working. So I sought to convince him that I could give him a better setting to care better for his patients. And after about a year, I finally did convince him, and I've been thankful to have him with me and caring for his patients. And my wife likes this story that when he was first joining us and his patients were calling our clinic to join us, one of them called and said, now listen, I don't want to see that other guy. I just want to see Dr. Lipinski, and that other guy being me. And so that was a sweet, humbling moment for me. That was one of those communications that told me it is indeed not about me. It's about the relationship between the doctor and between a caring doctor, an attentive doctor, and a patient who would like to be cared for. And so we have never grown by just grabbing somebody off the street who needed a job. We found Dr. Lipinski in that manner, and it's a similar way in which we found Dr. Eberly. There are other opportunities, and will be more opportunities to meet Dr. Eberly. The Weaver Street Market has done a video to introduce Dr. Eberly to their members, and that video is available on our website, which Dr. Eberly speaks some about himself. And we will bring him to Raleigh sometime this spring, and hope to have an in-person opportunity for prospective members to meet him. But I met Dr. Eberly about 4 years ago through a colleague Dr. Farr Curlin, who runs a program at Duke University in which it's a dual program between the School of Medicine and the School of Divinity that asks the academic question is really the pursuit of the calling of healthcare. What is the calling of medicine and nursing? And Dr. Eberly had sought out that program, was studying in that program as he himself was seeking his calling and vocation. He went to medical school feeling called into this work based on the witness of the work through his father and grandfather, who are both primary care physicians, family physicians in South Carolina, where he is from. And he had found that work to be worthy work and work that he wanted to do when he came of age. And so he went to medical school thinking that's what he was heading to do. And he found what I found and what Dr. Lipinski found, the somewhat bewildering world of modern depersonalized industrial medicine, where the sanctity of the doctor-patient relationship is not particularly honored, and he was dismayed by that and trying to find his way. And so he found his way to Duke University in this program of study, and Dr. Curlin referred him to us as an example of a place where he might be able to do the work that he thought he was setting out to do. That was in the summer of 2018. He spent a day with us, and you can find a piece that he wrote after he spent that day with us, which is an encouraging piece of writing to me. And one of the things that I would commend Dr. Eberly to about is that he's a wonderful writer in addition to a wonderful doctor, and it speaks to his mind and his heart. When you read his writing, you'll get a sense of who he is and what he's after. But happily, that day that he spent with us did convince him that this was work that he did want to do, and it spoke to him as the way that he should fulfill his calling. And so that prompted him to go back into training and back into residency, and which he's now completing. He's the chief resident at his program in Anderson, South Carolina. He's the kind of person who would be elected the chief resident, who would be rise to the top of whatever group he is part of. And he came and spent another couple of weeks with us last summer. Some of you met him in that setting. And at the end of those 2 weeks, we offered him a job. And when I had to fill out his assessment for the residency program, I said, well, I think it's probably enough to say that we offered him a job. I don't know what higher praise there would be, but really it wasn't just that we offered him. We had been hoping that he might consider us all along, but and then after some consideration with his wife, they did decide in the fall to join us, and then he'll be coming in August. As I said, I'm now speaking to those of you who have settled in for the long haul, and I'm telling you the long story. But I think the long story should communicate to you the depth of our commitment to Dr. Eberly, the depth of Dr. Eberly's commitment to his work, and I think truly the blessing that he will be to his patients. And when I first came to town in 2007, excuse me, it was at the invitation of Dr. Bob Bilbrow, whom some of you know. Many of my longtime patients were patients of Dr. Bilbrow's before me. And I would not be here without Dr. Bilbrow, and I wouldn't really know how to do my work without his witness and Roxy, my nurse, to whom Dr. Bilbrow gifted to me and who helped me get my start in Raleigh. Dr. Bilbrow very intentionally selected me, got to know me, introduced me to his community of patients, and conferred the trust that his patients had in him to me. And I am with Dr. Eberly, although I'm not retiring and I'm nowhere close to retiring. I'd like to confer that trust that you all have in me to Dr. Eberly in the way that Dr. Bilbrow did for me. And so I appreciate very much that many of you have been waiting, thinking that you're waiting for Dr. Fischer, for me in particular, to care for you. And I think the best way I can care for you is to tell you that this is the person who should care for you. He will care for you better than I can because he is fresh and has capacity. In true humility, I would say I think he's a better doctor than I am. He's bright and capable and has a heart of gold. And he's who I think you ought to see. I look forward to introducing you further as time goes along. I have a little sense, those of you who because I see your mother or brother or sister, and you just say I've got to see Dr. Fischer. With time, there are some of those situations that I hope I can personally attend to, but as a statement overall, I would love to offer you Dr. Eberly as the best way I can care for you. Okay, folks, she tells me it's time to wrap it up, so I think I've said all I can say and shed all the tears I can shed for today. We thank you for standing with us, clinic members and prospective members, and we look forward to sharing our work and our lives with you. Thank you.